Northern Ontario's population is aging, and as we age, we need more healthcare. If you are 65 or older and visit our emergency department, there is a 30% chance you will have to be admitted to hospital. If you are 75 or older, that likelihood increases to 40%. On average, 15% of all seniors admitted to hospital have to be readmitted soon after they are sent home. To build on the programs and services we've already put in place, Health Sciences North is introducing 2 new models of care for seniors. The first model will make the patient's transition from the hospital back home more coordinated and effective. Called the Continued Care Plan, this initiative is for seniors over the age of 75 who have chronic health conditions such as heart or lung disease and who are at higher risk of being admitted to hospital once they go back home. Here's an example of how it works. 75-year-old Joe Smith lives alone and has a history of diabetes and heart disease. Joe came to the emergency department experiencing chest pains and shortness of breath. He was admitted to hospital. Joe is now stabilized and ready to go home. Before Joe is discharged, he undergoes a comprehensive assessment to identify his risk factors and what type of assistance he will need when he returns home. A single, coordinated, comprehensive care plan is then developed, involving all of Joe's healthcare providers, including his family doctor. Health Sciences North and the community partners then work together to ensure the plan is put in place. Once Joe returns home, his plan follows him. The coordinated care team at Health Sciences North, made up of registered nurses, will follow up with Joe to ensure the plan is working.
Obviously, it's a much nicer place to recover, to recuperate, to be in your own place. But people need a coordinated plan of care that is developed with your healthcare providers in the hospital that translates into the community.
A team member will visit Joe at home within 1 day of his discharge from the hospital. The team visits Joe again 1 week later. There will also be follow-up assessments of Joe 14 and 30 days after he left the hospital to see how he is doing. By coordinating the care plan for Joe, we can improve Joe's overall health and help him live independently. If Joe does need to be admitted to hospital, his care plan follows him, where it will be referenced and revised as needed. The continued care model has been successful in other areas where it's being used, with readmission rates for patients reduced by as much as 50%. Health Sciences North is aiming to launch the continued care plan in the summer of 2012. The second care plan that Health Sciences North will launch is known as the virtual ward. It is a modern approach to the traditional house call. Let's look at how the virtual ward model will work. Jane Brown is 78 years old, has chronic heart and lung disease and diabetes. She has been to hospital numerous times because of her health. She has just been treated for congestive heart failure and is ready to go home. But Jane is at high risk for readmission to hospital.
I've also written down here the medication.
Under the virtual ward model, Jane is discharged with a comprehensive care plan, as she would be with the continued care plan. But with the virtual ward concept, a multidisciplinary team of healthcare providers would be available to provide around-the-clock care in Jane's home. For example, if Jane needs help understanding her medications or is experiencing any new symptoms, she will be provided with in-home support services from the virtual ward team. The virtual ward care team at Health Sciences North will be made up of doctors, nurses, pharmacists, therapists, and other allied health professionals. Health Sciences North will launch the virtual ward pilot project in the fall of 2012.
Given the demographic, not only in Sudbury, but also in Ontario and the rest of Canada, and given the amount of resources available to us, then patients will request to be treated at home, but with access to nurses and physicians, with the quality of service, the safety of care that they would encounter otherwise if they had been admitted within a medical ward or surgical ward of this institution.
These 2 new plans, continued care and virtual ward, will improve access to healthcare, health outcomes, and the quality of life for seniors. In the near future, Health Sciences North will introduce more new initiatives to improve patient care. They include new ways of providing primary care to seniors, such as partnering family physicians with registered nurses to provide more comprehensive care, developing a day health center program using HSN physicians and other healthcare professionals to enhance hospital-based services for seniors at risk, At Health Sciences North, timely, innovative, and effective patient care of the highest quality is always our top priority.